Welcome to the MamasteFit YouTube channel. In this workout, we're going to be targeting creating space within the pelvis to help prevent labor stalls. There's common things that may be going on during pregnancy that may be decreasing space within your pelvis, and so we're going to address that in this workout. If you want more workouts like this, be sure to subscribe to our channel so you get notified whenever we release new workouts. We release new workouts every Tuesday. And if you want to dive deeper, be sure to check out our prenatal fitness programs, where we offer them as full-length videos like this or as self-paced workouts in the Team Builder app. And you can use code YouTube10 to get 10% off any of our online offerings. For this workout, the only thing that you're going to need is some sort of elevated surface for the first exercise. It can be a chair, it can be a bench, it can be your couch. We just need something to be able to kind of pull from to do our lat release. And then you're going to want a yoga block or a small stack of books for some of the last exercises that we're going to be doing. So once you've kind of got that set up, let's come down onto the floor to begin today's birth prep workout to help prevent labor stalls. The first exercise that we're going to be doing is going to be a lat release exercise. So you're going to come facing sideways to your elevated surface. This can be your couch or a chair, and we're going to be in this tabletop position. You're going to reach the outside arm across onto that elevated surface, and then you're going to come into this quadruped position, so chest is towards the floor. Grab onto so you feel a big stretch through that side body. So we're just going to feel this stretch through here, and we're going to be here for 1 minute, and then we're going to switch to the other side. So big inhale into the side body, so feel like these ribs on the side expanding. And then exhale, almost think kind of pull or lean a little bit further away. And we're seeking a sensation through this side body, through this lat, to feel this big release. During pregnancy, a lot of us tend to have tighter lats just due to common postural tendencies. So we tend to arch a little bit more in our back. His belly is kind of pulling us forward. And this can result into some compression into the lats, which could impact how well you can create space within your pelvis. And so one of the things that may contribute towards a labor stall is pelvic mobility, or how well you can create space within baby's path. And having tight lats can sometimes prevent you from being able to create some space front to back in your pelvis. So big inhale into that side body. Exhale, release. And let's go ahead and switch sides. So now you're going to face in the opposite direction. That outside arm is going to reach across to grab on, and then try to have your chest be parallel towards the floor. Inhale, feel the side body expand. And then exhale, maybe you crunch a little bit more to the opposite side. Maybe you kind of sink a little bit deeper. But we're trying to seek a big stretch in that side body. Big inhale into those ribs. Exhale to let go. And so again, a lot of us tend to have tighter lats during pregnancy. We tend to favor that more extended position. So doing lat releases can be really beneficial because it helps to create more space front to back in the top of our pelvis. If our lats are pretty tight, it's going to make it really hard for us to find a more tucked position with our pelvis, which helps to create space in the back half of the pelvic inlet and the pelvic outlet. Go ahead and move towards the side, and we're going to come to the floor in a 90-90 position. So one leg is going to be out in front, and the other leg is going to be behind you to the side. And so in this, we're going to be doing a 90-90 side camel. So place one hand behind you, and we're first going to reach towards that internally rotated leg. And then we're going to place that hand down and extend in the hip to feel this big stretch through that hip flexor of the back leg. Place the hips down, and we're going to lean towards that back leg to feel this side body opener. That hand comes behind you, and then extend in the hip. So we're moving from a side body opener to an extended hip position, just kind of alternating between the two. Because we favor that more extended position, we're arching in the back and belly is falling forward, we also tend to have very tight hip flexors. And so this movement is addressing kind of that side body lat tension, so stretching through there. And then this hip extension, you should feel a big stretch through those hip flexors You can almost think like try to tuck your butt underneath as you push the hips forward. So reaching across and then extend in the hips. Now place those hands behind you, and we're just going to kind of alternate from side to side. So windshield wipering those legs. We're finding internal to external hip rotation. And this is going to be more of an open chain. So the feet are not really on the floor. And so we're focusing on moving the femur in the pelvis. And so this is going to be more internal to external hip rotation, which is important to help us create space within the pelvis. And just kind of pay attention to, does bringing my right leg to the front or my left leg to the front feel a little bit more challenging? Because one side will probably feel a little bit different than the other. So just continue to windshield wiper those legs, just paying attention to the sensation. Again, pelvic mobility is a key thing to creating space within our pelvis to make it easier for a baby to pass through. Now we're going to end up facing the other direction now. Reach over for that side body opener. So I'm leaning towards that back leg. Hand comes down and then extend in the hip to feel the big stretch through that hip flexor. So we're finding the side body opener and then extending in the hip. So with the side body opener, you should be sinking a little bit more into that back hip. So a little bit more of a kind of a groin stretch there. Reach behind, extend in the hip. Again, at the top, you can almost try to tuck that butt underneath just a little bit to feel even more of a hip flexor release. And so you may notice that one side feels a little bit more sticky compared to the other. And this is pretty normal. We have normal asymmetry within our pelvis where it just kind of sits a little uneven on both sides. It doesn't necessarily mean there's a problem, but it is something for us to be aware of when we are thinking about preparing the pelvis to open for birth. So now I want you to come on to your side. You can grab your yoga block if you'd like, or you can just have the knees together. And so in the side body position, we're going to start focusing on a hip shift. So I'm going to drive my top knee back and just feel a little bit more of a stretch in this top glute. So as I shift back, I'm trying to bring this top hip or glute further back than the bottom one. You're going to come back and you're going to kind of squeeze in that block. And you can even bring that ankle up, but I want to feel a little bit of a hip shift here. And now it may not be super intense because we're in an open position, we're in an open chain position. So in this one, it's the femur that's moving within the pelvis. And so we're just kind of holding here. Maybe you're removing the block and you're kind of moving forward and backwards with it. But we're trying to feel how that pelvis is kind of moving with that femur. If you have a foam roller or a big pillow, you can also use that instead. But we want to try to begin to feel this hip shift in this open position. So we're trying to feel a stretch here. Now let's come into a side body position, and we're going to kind of take this to the next level. So now I'm trying to feel it in this bottom hip. I'm going to start by shifting that hip forward. So my belly is coming more towards the floor. I feel more of a stretch in that bottom glute, so it'll be the opposite one. And then I'm going to exhale to come forward and face my hips to the front. I'm going to come down, belly's going to come more towards that thigh, and then I'm going to extend my hips forward to find more external hip rotation. So I'm coming down to a more closed hip position, feeling more of a stretch in that bottom glute, and then coming forward. And so this is a really similar motion to what we were doing with that side lying position. So we're moving that femur and that pelvis. So they're changing position with one another. So keep moving through that. So what's happening here is your femur is here within that pelvis, and the pelvis is coming forward, and then it's extending to the front. So it's coming forward, and then it's extending to the front. And this is different from what we were doing earlier, because before, the femur what was moving, and now it's the pelvis that is moving on the femur. So let's go ahead and feel this on the other side now. So the top leg is going to be the leg that we're shifting around in. And then we're going to come back to that bottom leg to feel it a little bit more. And so if you want to take that yoga block, feel free. We're going to come into that side body position. I'm going to drive that top knee back. I'm going to squeeze that block, and then I'm going to breathe here. So big inhale. Hopefully you're feeling it a little bit more in that top like hip pocket area. It's okay if you don't. Again, this is a very passive position. If you don't, you can also try to find a little bit more of a round in your back. And what this is doing is it's bringing a little bit of a shift into our hips. So it's driving the tailbone towards one side. So we're feeling more of a stretch here in this posterior pelvic floor. And we're going to take this to a more upright position where you're going to feel it more. But I want to help you begin to feel a little bit of that shifting within your pelvis in a very supportive and restorative position. So you may be feeling it more in the bottom leg, whereas you come forward, you feel a little bit more of a stretch there. So belly comes a little bit more towards the floor, and then you come back, maybe you feel it towards the top. And now we're going to come back to that side lying position. So elbows on the floor, ankle, hip, and elbow in a generally straight line. And I'm going to start by driving that top knee forward so belly's more towards the floor. And so here I'm finding that closed hip position on the bottom, more of a stretch in that bottom glute. And then I'm going to exhale to rotate forward so hips are now facing forward for that open hip position. And then come back to rotate belly towards thigh. So open up and then close. And same thing here, my pelvis is rotating on that femur. So it's rotating towards that bottom femur, and then it's rotating to open. This is helping to improve pelvic mobility. So internal to external pelvic mobility, which is different than internal to external hip mobility. So with internal external hip mobility, it's this, the 90-90. This knee is moving out. This femur is rotating out. Pelvic mobility is this. So pelvis is coming to a close, to an open position, to a close, to an open position. So belly towards the thighs, you lower down, exhale, open up, hips face forward. Rotate down, hips face forward. And now we're going to move to some more upright positions. So we went from that side lying now to a tabletop position, grabbing on to your yoga block. So you're going to place one knee on that yoga block, and then we're going to shift our weight over towards that elevated hip. So you can lift that bottom leg and your position would not change. Feeling a big stretch through this hip pocket. And now we're going to move through some pelvic tilt. So drop the belly towards the floor, and then exhale, pull belly to spine as you round. Inhale, drop belly to the floor. Exhale, pull belly to spine. So all of these hip shifting movements, they might feel a little confusing. That sideline one might have been like, I don't really understand what we're doing here. Hopefully, as we progress towards these hip shifts, you'll be like, I'm feeling this a little bit more. So again, we're trying to improve pelvic mobility. So how well does your pelvis move on the femur? And how well does your pelvis create space to allow your baby to navigate through? For a lot of us during pregnancy, because we favor that more extended position and also more externally rotated position, it tends to decrease space in the back part of our pelvis. Now we're going to keep weight in the knee that's on that yoga block, and I'm going to drive my knee straight up and then back down. So now I'm moving that pelvis on that femur, similar to that side lying star position that we were doing. So belly is coming up and then back down. So at the bottom, my belly is more towards the thigh of the elevated knee. And then as I come up, my belly is now more towards the thigh of the lifted knee. So you should feel like that pelvis is moving. Thighs are fairly close together. You may feel like a little bit of like a burning, right? Because that glute is working as you go from side to side. So all of these hip shifts are helping to create space in the back part of our pelvis, stretch more of that posterior pelvic floor, and to help us to find more internal hip rotation and internal pelvic rotation, which tends to be a little bit more neglected during pregnancy. So now we're going to switch to the opposite side. So now with my opposite knee, I'm going to place it on that yoga block, I'm going to shift my weight over, and we're going to move through those pelvic tilts again. And one side will probably feel a little bit different than the other. So drop the belly to the floor, look forward, and then exhale, round in your back. Inhale, drop belly forward. Exhale, pull baby to spine, round in your back. So again, these hip shifted exercises, releasing tension in the posterior pelvic floor, where a lot of us hold more tension during pregnancy. It's helping to improve pelvic mobility, particularly to the back half of your pelvis, and improve internal hip and pelvic rotation, which are a little bit harder to find during pregnancy. And if we can't find this internal pelvic rotation, it could make it really hard for your baby to finish the rotation out of your pelvis. And so if you have like a late labor stall where you're stuck at 8 centimeters, it could be related to mobility at the bottom of the pelvis. If you're pushing for a really long time and baby's just having a hard time finishing that rotation, it could be related to mobility down here as well. Now, same thing, we're going to lift that knee straight up and then straight down. Thighs are staying fairly parallel towards one another. And so in this, I'm finding my open hip position and then coming back down to my closed hip position. So we're rotating that pelvis on that femur, feeling like a lot of movement happening kind of in that hip socket area. All of these hip shifts and this pelvic mobility stuff are really fine movements. And so you've got to kind of wiggle around in them and explore to at least find the sensation that you're seeking. And what we're seeking is kind of like this big stretching feeling in this back hip pocket area. And it may just take like a little bit of like positioning change and wiggling around to really find it. All right, so now that we've been in a tabletop position, we did the sideline, we're going to bring this up right to a standing position. So you're going to place one foot on to that yoga block, and I'm going to bring my opposite foot flat on the floor as I rotate my belly towards that thigh. And now this may be enough for you where we're just like literally standing with more of a shift, or you can bring the hips back in a hinge. So we're here and I'm shifting the hips back, keeping lots of weight in that big toe of the elevated foot. And so the thigh is almost kind of like rotating in as your belly is rotating towards that thigh. So we have this kind of counter rotation happening. So we're seeking that sensation in that hip pocket area, just kind of reaching forward. And then if you want, we can add a little bit of movement. So extend in the hips, so now we're facing forward, and then shift those hips back. So we're coming in and out of it. So we're finding that open hip position to that closed hip. Because again, this is helping to stretch that back half of the pelvic floor. It's helping to create more space in the lower mid-pelvis or the bottom part of the pelvis, which is really important to helping our babies finish their rotation. And so if there's times for labor stalls, we'll go ahead and switch sides. It is sometimes because baby's having a hard time getting in to the pelvis, and it could also be related to baby having a hard time rotating out of the pelvis, which is what all of these hip shifts are really beneficial for. So placing that foot on that yoga block, again, we can either just bring that other foot flat as we rotate belly towards thigh, or we can add a little bit of a shift or a hip shift or hinge backwards. Again, belly is towards that thigh, so we're kind of rotating here. You should feel more of a stretch. Weight in that big toe and thigh kind of rotating in. So seeking this sensation back here. If you're not really feeling it, you may be super arch, or you may be doing this like weird thing here. So think slight tuck underneath, rotate belly towards that thigh. Hips come back just a little bit. Lots of weight in that standing leg. And if you want, we can add in that hip extension to come back. So moving in and out of it. So closed hip position, internal pelvic rotation. Open hip position, external pelvic rotation. So that concludes all of the exercises that I would be incorporating throughout my prenatal routine. So you can do a lot of these exercises daily. You kind of spread them out throughout the week. But the main things that we're focusing on is releasing tension in the lats, in the hip flexors, to help improve pelvic mobility from front to back. Commonly during pregnancy, we favor more of that extended spine position, which can compress the lower back and really compress those hip flexors, which can make it hard for us to find that tucked position. And we need that tucked position to find more space front to back in the top of the pelvis to help our baby enter into the pelvis. And so if we have a limited mobility to find a posterior pelvic tilt, it could make it really hard for our babies to engage into the pelvis. And then remember that these are common postural tendencies. So a lot of us tend to have that tension in our back and in our hip flexors. When it comes to those hip shifted movements, we're shifting our weight into one leg, which is going to shift that tailbone towards one side. And this is going to help to stretch the posterior pelvic floor and to create more space in the lower mid pelvis, or the lower half of our pelvis. This is really important to helping your baby finish the rotation within the pelvis, also releasing tension within the pelvic floor, because a lot of us tend to hold more tension back here. And so incorporating different hip shifts into your workout routine can be really beneficial to helping to relax your pelvic floor, which will probably help if you're having tailbone pain, SI joint pain, or even pubic pain, in addition to creating space within your pelvis. And so if you want more exercises like these, be sure to check out our online prenatal fitness programs, because we break down our workouts in so much depth. We're not just trying to do random exercises to get you tired and make you sweaty. You're going to be challenged with our workouts, but we want to actually create space and have the movements that we're doing be worth your time. So if you want more workouts like this, check out our online prenatal fitness programs. We offer them as full-length workout videos in addition to self-paced workouts in the Team Builder app. You can also bundle our prenatal fitness with our childbirth education and pelvic floor prep, or you can even bundle it with postpartum workouts as well. So check out all of our options on our website at MamasteFit.com. If you want to check out our bundles, it's MamasteFit.com/bundles. Bundles are all 15% off, and you can add on an additional 10% off with code YouTube10. So thanks so much for watching. If you like this workout, be sure to subscribe. We have new workouts every Tuesday.